on my mind, I guess it goes like that.
Today I've got Daphne here with me. We're going to do a demonstration with what is probably one of the coolest products I've ever seen, and I would have loved this if it was around when I was in clinic. And I think it's going to make a huge difference for vets doing surgery. So what it is a patient support mat. Basically, you put it down on your surgical bench, just like I've got it down on here, or wherever you might be doing a procedure. And this is going to form like the perfect groove around your patient so that they aren't rolling back and forth. If it's a deep-chested dog, you need this. It is to reduce the need for those kind of towel rolls that people use in clinics, or the supports that people use when they're doing x-rays. These can be used for x-rays as well. There's two different sizes. This is the small and this is the large one. This is one I'm going to use for an example, but this kind of gives you can kind of see, used for cats and small dogs. I probably use this for Daphne size as well, but how it works is you anesthetize your patient if you're doing surgery or x-rays, you know, that kind of positioning that you need. You anesthetize them, intubate them, position them, hook them up to their anesthetic, get them all prepped, and then we want to secure them in that position on the mat. Quite often that it's going to be in a VD sternal kind of position. For Daphne, I'm not going to put her on her back because I don't want to stress her out, but I am going to position her so as if she was laying kind of DV, and then I'm going to show you how it works. It looks from the video that it's not really changed at all, but then when you feel it, it makes all the difference. So you got your pump. Daphne's made herself nice and comfortable there, so I might actually just work around her. So you can see that she's nice and snug, and you can see that it's kind of tucked in around her. It's essentially like a big beanbag. So it's nice and floppy all around here. You can move it. So now I'm going to use my pump and I'm going to remove the air. All I need to do is really easy. Remove this grey cap like this. Attach the pump to the end like this. I would probably do this when your patient is just kind of settling into their anaesthetic. I would attach all my monitoring equipment and things like that first. All of the air has been removed. And so her little body, can I lift you up a minute? And it's formed this perfect kind of position where her body was. Like the perfect indent. So if she was laying on her back, it's not only supporting her back from being on a hard table with this kind of beanbag effect, but it's holding her in place as well. And all we do to let it down is undo this grey nozzle, isn't it? And you can hear the air all come out. And now it's going to go all floppy again. And then you can reposition it for the next patient. I might do a demonstration with the small one with Daphne on her back because she's quite relaxed right now. On here, grey nozzle, make sure that that is tight. That's the one that I'm going to take off, and that's where I'm going to pump the air out of. Okay, so she's in position. It's formed a complete trough around her. Her back is nice and comfortable. She's very comfortable right now. She's going to fall asleep. So I'm going to insert this into here. You're a good girl. That in and remove the air. And this memory. I'm going to take that off, place that back on, and I'm going to take you off. Yeah. And it's formed a perfect trough in there for her.
Because it's something, but it's on my mind, I guess it goes.